Lanka Hospitals is Sri Lanka's only hospital equipped for air ambulance services. We are a multi-specialty hospital that combines state-of-the-art facilities with cutting-edge technology, skillfully guided by a team of experienced and well-trained experts. We have a range of specialized departments. These include Blood Cancer Center, Heart Center, Fertility Center, Women's Wellness Center, Radiology and Imaging Department, Gastroenterology Department, Surgical Unit, Neurosciences, ENT Clinic, Kidney Care Center, Eye Clinic, Dental Clinic, Cosmetic Clinic, Diabetic Clinic, Men's Wellness Center, and Health Link. Lanka Hospitals. We are there 24 hours a day, 7 days a week to help you be your best self. Capable people with unparalleled experience, providing extraordinary health care. Lanka Hospitals. Caring, curing.
සුබ සන්දාවක් ඔබ සැමට. මම තිලිනි. කොන්දේ සහ බෙල්ලේ වේදනාව පිළිබඳ සජීවී සාකච්ඡාව වෙත ඔබව සාදරයෙන් පිළිගන්නවා. මෙම සජීවී සාකච්ඡාව ලංකා හොස්පිටල්ස් විසින් සංවිධානය කරනු ලබන අතර එය ප්‍රවීණ විශේෂඥ මණ්ඩලයක් විසින් මෙහෙයවනු ලබනවා. අපගේ සාකච්ඡාවෙහි මූලික අරමුණ වන්නේ අද අප සමාජයේ බහුලව දක්නට ලැබෙන සෞඛ්‍ය ගැටලුවක් පිළිබඳ උපදෙස් ලබා දීමයි. කොන්දේ සහ බෙල්ලේ වේදනාව විවිධ හේතු නිසා ඇතිවිය හැකි අතර අපි අද අපගේ සාකච්ඡාවෙන් මෙහි ඇති පොදු හේතු කිහිපයක් සඳහා අවධානය යොමු කරන අතර කොන්දේ සහ බෙල්ලේ වේදනාව හෝ අපහසුතාවය වළක්වා ගන්නේ කෙසේද යන්න පිළිබඳ කෙටි උපදෙස් කිහිපයක් අපි ඔබට ලබා දීමට බලාපොරොත්තු වෙනවා. මේ සාකච්ඡා මණ්ඩලය ලෙස සර් ජෝන් කොතලාවල ආරක්ෂක විශ්වවිද්‍යාලයේ සහ ලංකා රෝහලේ විකලාංග ශල්‍ය විශේෂඥ වෛද්‍ය දේවක රත්නපාල මහතා සහ සර් ජෝන් කොතලාවල ආරක්ෂක විශ්වවිද්‍යාලයේ වෛද්‍ය විද්‍යාව පිළිබඳ ජ්‍යෙෂ්ඨ කතිකාචාර්ය සහ ලංකා රෝහලෙහි රක්තවාත විශේෂඥ වෛද්‍ය සචිත්‍ර ඉලංග තිලක මහත්මිය යන වෛද්‍යවරුන් දෙපළත් ලංකා හොස්පිටල්ස්හි ජ්‍යෙෂ්ඨ බෞද්ධ චිකිත්සක බුද්ධික රොඩ්රිගෝ මහතා සහ බෞද්ධ චිකිත්සක මොහොමඩ් වෙස්මි මහතාත් සහභාගී වනු ලබනවා. Good afternoon, everyone. I welcome you to an informative live webinar on how to overcome back and neck pain. This live session is organized by Lanka Hospitals and we will be addressed by an expert panel of speakers. The purpose of this webinar is to offer health tips and advice on back and neck pain, which is among one of the most common health concerns among people. Back and neck pain can be due to a variety of causes, and we will break down a few of the most common causes in our webinar today and offer you some tips on how to prevent or overcome pain, discomfort, or uneasiness in the back and neck. Our panel is here today to offer you with their expert views. I will take this opportunity to introduce our panelists today here with Dr. Devaka Ratnapala, consultant orthopedic surgeon, and Dr. Sachitra Ilangathilaka, consultant rheumatology and rehabilitation, and our resident senior executive physiotherapist, Mr. Buddhika Rodrigo, and physiotherapist, Mr. Mohammad Vesmi. May I invite Dr. Sachitra Ilangathilaka, consultant rheumatologist, to address the audience. Over to you, madam.
Good afternoon, everybody. Thank you, Thilini, for those kind words of introduction. So the topic of neck and back pain, I think it's a timely topic in this day and age. Of course, Dr. Devaka will agree with me that neck and back pain forms the bulk of our practice among rheumatologists and among orthopedic surgeons. But with the global pandemic, it has taken a new meaning because there have been so many lifestyle changes. In fact, there had been a paradigm shift of the way that we do things, like things of how we learn, how we work, and we have taken up so many recreational activities during our leisure time, which we got during the lockdown period. So all these things, as much as it has helped us to evolve with this pandemic to do our day-to-day activities, they can have some health concerns if we don't adjust and think about our health. At the end of this webinar, where we talk about the back and neck pain, and with the help of our physiotherapy colleagues, you will realize the importance of what I'm talking about now. So without further ado, let me move on to my presentation, which is on neck pain. So this is going to be the overview of my presentation. I'm going to talk about the bit about the structures of the neck, and we'll discuss about common causes and associated symptoms, and how to identify sinister causes and the management and some preventive measures. So if you look at the structures of the neck, there are several layers. So muscles form one layer. So if you look at this picture, you can see there are so many muscles in the neck, and some of them, they span across the neck, and some of them gets attached to the back of your skull, and some gets attached to your collarbone, some to your the bones in your upper arm, right, and some to the back. So you will see the implications of all these muscle attachments as we discuss this topic of neck pain. So in addition to the muscles, there are bones. So there are 7 bones in our neck, which are stacked on top of each other, and they are bound together by what we call the ligaments. So all these structures can give rise to pain in the neck. And then we have the nerves. So I told about the bones in the neck. So these bones, they cover our spinal cord, what we call Sushumnava in Sinhala. So that is like the cord which transmits the signals from the brain into the rest of the body. So these, while protecting this spinal cord or Sushumnava, these bones, they let out the branches of that arise from the spinal cord, which supply supply the our limbs, that is upper limbs, our arms and legs. Right? So so then we'll move on to the causes. Now that you know, you have some idea about the structures of the neck, you will be able to get an idea how these structures bring about pain in patients, right? So this is now, if you talk about the causes of the neck pain, the most common one is the muscle strain related to poor posture and overuse. Now, if you, so this is a typical example. So this is what we call the text neck. I think most of us are guilty of this posture, right? That does not mean that it is good for us. So our neck is designed to carry a weight of, you can see, about 5 to 6 kilos. So if you remember your physics, so when the neck bends forwards, we are carrying about 6 times the weight that our neck is supposed to carry, which puts strain on our neck muscles. So that causes neck pain. And then poor posture, especially in other positions like standing. So you can see the first picture that shows a good posture, right? But if you look at the other ones, these are different types of postures, and like you can look at this and get and assess for yourself which posture that you have. So you can see in some of these postures, the curvature, the nice curvature of the neck is augmented or increased. And in some, it's actually lost, like in this military posture, right? So all these causes strain on our neck muscles and gives rise to neck pain. So this is another poor posture. Now you see the correct posture of sitting is supposed to be the last one, the one that is shown at the fourth picture. So your ears, your shoulders, and your hip, they should be aligned with each other, right? But in these other postures, you can see there is no alignment, and that puts strain on the neck muscles. Another cause is the muscle spasm, which means contraction of your muscles. So the muscles will bunch up, like, and which this occurs due to so many reasons. Now, here you can see in this picture, in this patient on this side, the side marked with red, you can see there is sort of like a swelling. So most of these patients will say, I have a gediya, right? But in fact, this is not a like, you know, a gediya like that. It's not a tumor or anything. It's in fact your muscles which has gone into spasm, and that becomes prominent on this side. Right? Now, this can happen due to so many reasons. So one thing is, as we discussed before, the poor posture, and then the wear and tear changes in the neck. And if a nerve is impinged, sometimes emotional stress and neck injuries, all these things can cause muscle spasm. So these spasms are the body's way of protecting against the harmful agent. But the downside is, while protecting the body from further injury, it causes a lot of pain to the person who is having the muscle spasm. And then other thing is the commonest thing, another common thing is the wear and tear changes. So, you know, in your spine, there are like these, I talked about these bones, and there are discs in between these bones, and they can wear out with age. And then there can be so many changes in the bones, and these changes can bring about pain. The other thing is these discs, they can prolapse, go out of place, and then they can impinge on these nerves. These trapped nerves give rise to pain, which can usually go along your arms. Right. Other thing is trauma. Now, although you don't have a bone break after an accident, this there can be so many soft tissue injuries which can cause neck pain. Now, this is a typical one, which we call the whiplash injury. So there is acceleration, which causes the neck to bend backwards more than its range, and then there is deceleration. So the neck will bend forward more than its range. So that can cause soft tissue injuries. In addition to all this, there are other causes. These are not very common, but sometimes infections like TB, different types of arthritis, and sometimes even cancer can give rise to neck pain. But these are very rare. So in addition to neck pain, these patients can also have associated symptoms. Like, you know, in addition to neck pain, they'll have a headache. If you can remember my first diagram, you can remember that some of these muscles gets attached to the back of the head. So it can give rise to headache, and then arm pain, sleep disturbances, and sometimes like dizziness, any radiating pain along the arms, pins and needles. All these things may be associated symptoms with the neck pain. So how do you find out that this is a neck pain that needs evaluation? Or is this just a neck pain related to muscle spasm? Right? So you have to keep and think about these red flags, and if these are present, then you should seek medical advice, right? So if you are having fever together with this, loss of weight, loss of appetite, weakness in the legs, disturbing pain at night, and any recurrent radiating pain warrants medical attention. Right now, so once you go to a doctor, they will take the history, they will examine you, and then they will do some investigation. So these are the common investigations that we do. Those are X-rays. So mind you, X-rays will only show your bones, but they give a lot of information. Like in here, now if you have your normal neck will have a nice C-shaped curve like this. shown in this one. And then here, when the muscles go into spasm, it will be in a very straight line, right? And then sometimes this wear and tear changes. All these things can be seen in an X-ray. And there can be bony overgrowths, which we call cervical ribs. These also can cause nerve impingement. They can cause muscle spasm and cause neck pain. So if the X-rays are not helpful, we may need to go for sophisticated investigations like MRI scans, which will show not only the bones, but other structures in our neck. So in addition to these things, we will be doing blood tests to look for any sort of inflammatory arthritis, whether this is an infection, whether there is underlying cancer, and all these things. Right. So the management, in fact, depends on the cause. So with all these things, your doctor will be able to get an idea as to the cause for your neck pain. But I'd like to highlight certain things which are important in your management. So number one is good posture. So in everything that you do, including cooking and answering your phone and sleeping. And then ergonomics. That is like, that's how you design your workplace to cater your function and your ability or disability, and also taking frequent breaks. Right, so now here in the second picture, you can see this is the sitting posture with a laptop. Now, most of you all during the lockdown period, your normal ergonomically designed workspace may be substituted by your living room couch, right? But that is not good for your neck. So here, the head should be nicely balanced over the spine. You can see the ear, the shoulder, the shoulder and your hip all are in one line, right? And the laptop is raised to your eye level, and then maybe you can use a pillow to support an additional keyboard. So now you are back to work. So then you have to think, even if you're using a desktop, how you should sit. Now here, same things, same line, and then your feet should be on the floor, and the knee and the hip, they should be at right angles. Right? So this will prevent many a neck pain in most of you. Right? And the standing posture. So you can see the first one shows the proper posture. Like in the sitting, the ear, your shoulder, and the hips all in one line. Right? So it wouldn't cause undue pressure on your muscles. Okay, now there's this famous Sinhala adage, hise amaruwata kotte wenas karata hariyanne naha kiyala. But in fact, that may be wrong, because if you sometimes your sleeping position or the pillow that you use may be in fact causing your neck pain. So it shouldn't be too low, it shouldn't be too high, and it should be just right, so that there won't be undue stress on your neck muscles. And then answering phone. I think all of us are guilty of this posture, right? We will cradle our phone between our ear and the shoulder. So you can see what it does to your cervical, your neck, right? Other thing is lifting weights. I think Dr. Devaka will discuss about this in detail in his presentation. So when you are lifting weights, you should always remember that your neck should be in a line, in the same line as your back, right? So that's what's shown in these pictures, right? And ladies, when you are working in the kitchen, right, you have to have your kitchen, designed or like altered in an ergonomic way, so that you will not cause much pressure on your neck when you are doing your cooking. So they say, like, if you see the elbow, couple of inches below that should be your preparation, where you chop your vegetables and all that. And then 5 to 6 inches below your cooking, where you should keep your stove. And if you are doing like things like baking, you'll be rolling dough and kneading. So then that should be even further down, right? So that you will not stress your neck or your back muscles when you are in the kitchen. Right, so how do we manage in addition to these tips? So there are so many physical therapies, like without medication that we can use. So we can use heat or cold packs, and sometimes electrical stimulation, which we call TENS. And then sometimes there is this thing called myofascial release. I think our physiotherapists will deal about it during their presentation, and also massage. All these things, they will relax the muscles and relieve the muscle spasm, which is causing the neck pain. And mind you, the muscle spasm, the pain that occurs due to other causes, other than muscle spasm alone, will also give rise to muscle spasm. So this will help in cases of neck pain due to other causes as well. Right, and then about the exercises. So to improve the strength, endurance, flexibility, and posture. So I think our physiotherapy colleagues will deal with this in more detail. And sometimes we may, most of the time we will be giving you painkillers and as well as muscle relaxants. But these two alone will not be enough to relieve your neck pain. And in certain cases, if there is a trapped nerve or if your spinal cord is impinged, then we may have to plan on surgery, right? But this is like not very common. Most of the back pains that we encounter in our practice is due to the previously mentioned causes, right? So I think I come to the end of my presentation. So I have given you so much of information, but at least keep these 5 in your mind. Like I've talked about, there are many causes of neck pain, but many of these neck pains can be preventable, right? And we have to identify the red flag signs like fever, loss of appetite, loss of weight, night pain. There we may have to resort to medical advice. And posture and ergonomics, they play a vital role. And it's not only medicine, but non-medication therapies should complement the drugs. Okay, so that brings to the end of my presentation. And thank you for your patient listening.
Thank you, madam, for the very informative presentation. Let's move.
Thank you very much. Thank you very much for the kind introduction. And Dr. Sachitra did a very good presentation and explained on neck pain. I'll be discussing about the lower back pain, and that has become very common as much as neck pain. And therefore, I won't go into too many technical details. I'll try to be brief, and I want to leave some time for my physiotherapy colleagues to go into more of the physiotherapy management of back pain. Now, of course, when you say back pain, what is low back pain? It is a pain experience. I'll show you with a picture after this, in the thoracic spine, lumbosacral spine, and the coccyx. Right. Now, this is the structure of the spine. Thoracic spine is the middle part of the spine, and then the lumbosacral spine is where you get commonly the back pain. And nowadays the coccyx, which is the tailbone, also leads to a lot of back pains due to prolonged sitting, which I'll come to details as I go along. Just an overview and a few general facts about back pain. Usually back pain, everybody will encounter 60 to 90% the time during their lifetime. So it's very common. And recurrent back pain also happens about 80 to 90%. Therefore, you need to look after your back pain. If you allow it to come repeatedly or neglect, you're going to have problems. And as you can see, there's a recurrent, that is a pain coming on and on again, 80 to 90%. Second most common complaint to seek medical consultation, and it's becoming more common these days, as all of us know, due to this COVID-19 pandemic, in school children, due to online educational programs. And it has become quite a bit of a problem. And we'll go into a little bit of details of that as we go along. Usually 80 to 90% of the back pains usually settle in about 2 months with proper management. And you don't need to go for surgery, as Dr. Sachitra said. Simple measures will help to relieve you from this back pain. We'll go into more details as we go. And 20 to 30% could progress to recurrent or chronic back pain. So that's why we need to properly manage back pain at the initial stage for us to prevent it from becoming a chronic problem. Now, the common causes of back pain, the commonest, as I said, is bad posture. And when you sit in front of a computer or in front of a meeting for a Zoom meeting, you need to, as Dr. Sachitra elaborated, your ear, the shoulder, and the hip has to be all in one line. If you try to be in an awkward position, bending forwards or sideways, that can lead to a problem in your back. And it can lead to a continuous strain on your muscle, and then it can lead to a muscle spasm causing back pain. The other thing is, when you're seated, you need to take breaks. Every 40 minutes, you need to at least minimum 40 minutes to get up, change your posture, walk around in your room a little bit. If it's possible, you can mute your video and excuse yourself. And if you can do that at least every 40 to 45 minutes, if you're having a long meeting, that will really help you to prevent these back problems. And now the next one is disc prolapse or a disc herniation, which is also called a slip disc. And here you can see the disc coming and touching the nerve. And that can cause quite a severe back pain. And that usually comes when you lift heavy objects in an awkward position and sudden back bending when you do exercises, maybe even in a gym, or sometimes nowadays we have got used to doing exercise by looking at YouTube or TV programs, and it's unguided. Therefore, you need to be very careful. If you are doing unfamiliar exercises just by going through a YouTube video, you need to be very careful. Therefore, initially, it's always better to start slowly and then do your exercises gradually to suit your back and your capability. Then, as I said, undercuts, physical activities and exercises, a fall, a motor vehicle accident, or a sudden blow on the back can lead to a slip disc and a herniation with a sciatica type of pain, and can lead to a motor or a motor weakness, that is a limb weakness and numbness. Traumatic fractures, of course, it has been going on and very common these days due to road traffic accidents and a fall from a height, even an assault. And you can see, you can get a fracture of your vertebrae, and sometimes the fracture can compress on your spinal cord or the nerve roots. And if it compresses on a spinal cord, you can get a neurological injury, which can be devastating. Sometimes you can get it in the neck where all 4 limbs can get paralyzed. And if it's below the neck, your legs can get paralyzed. And also with this, you can have urine and bladder problems, incontinence. So therefore, traumatic fractures are quite important, and they should be properly assessed and managed to prevent any kind of complications. Next one is also an interesting, especially for the ladies, osteoporosis and related fractures or conditions. Now, as you know, as age goes by, about 60, 65 years, mainly in ladies and in men after 75 years, they have heard this condition called osteoporosis, where the bone mineral density of the vertebrae goes down, right? And basically the mineral density reduction is called osteopenia. And when it becomes into a disease, it's called osteoporosis. Therefore, you can get this back posture bending, which is forward bending, it's called kyphosis, or sometimes it goes sideways, it's called scoliosis. And even with a subtle fall, the force may be minimum. You can get a, like I have shown in this picture, a wedge fracture. The top one is a normal vertebra, nice and square, and the one with the fracture is wedge fractures. Usually these are not serious fractures, but they can lead to quite a bit of long-term pain and chronic pain. And you can get this kyphosis where you see the back forward bending worsen with these fractures if you don't treat them with proper splinting or proper bracing. Then some other causes briefly, spondylolisthesis. That is, I showed in this diagram, one vertebra moves forward over the other, and it can lead to the canal of where the spinal cord and the roots go. It becomes narrow, and that can lead to neurological condition where you can even have bladder and bowel problems. Then coccydynia, tailbone pain, which I told you initially, that is very common with prolonged sitting. And sometimes you need to, I'll tell you how to avoid it. And of course, if you are seated with continuous pressure on your back region, this coccydynia will come, and once it sets in, it's very difficult to get rid of it. It goes on for weeks and months. So therefore, you need to try and, if you encounter this, you need to take measures, which I'll tell you, to allow it to prevent it from becoming a long-term problem. Then the other, not that common, is spinal tumors. It can be in the primary bone tumor, a spinal cord tumor, which are not that common. And of course, secondary deposits, like from a breast cancer or a thyroid cancer. I think we all worry about these tumors, cancers going and depositing in the breast, in the spine. So therefore, that also something that we need to be on the lookout. But we don't need to be paranoid for every back pain, saying that it can be a tumor or something like that. So you need to identify other problems and then gradually go for other causes. Then infection, not that common, bacterial or TB. Degenerative spine disease with facet, that is, the facets are the joints in between the vertebra. That is common with old age, and with the aging population in the world, we are having more of the degenerative spine problems. Ankylosis spondylosis is also a problem. That happens with a genetic predisposition, and that you get a very rigid spine, and the back, especially the neck, also can get affected. That's also not that common, but it does happen quite often. Then multiple myeloma is a condition where there's a plasma cell tumor, and that you need to suspect in patients with chronic back pain above the age of 60. Then how would you present with a back problem? Basically, obviously, of course, it will be low back pain. Then the low back pain with radiative pain along the leg, which is a sciatica type of pain. It can be one leg or both. Then reduced or restricted back movements with pain, and then numbness along a leg. There can be weakness along a lower limb. There can be back pain or leg pain when walking, where we call it spinal canal stenosis with neurogenic claudication. That is a serious condition where we need to seek medical help. And bladder bowel incontinence can happen as well. If there is, as I told you earlier, the spinal canal gets narrowed, then you can get the nerves that supply the bowel and the bladder, they get affected, and you can get incontinence. So that is the condition that you need to be aware of, but not to worry. Then these are called the red flag symptoms of back pain, which we need to roughly know when to seek medical help. It's if you get a pain in your thoracic region, which I showed you in the diagram earlier, you have to be concerned, and age less than 20 years or more than 55 years. Then loss of bladder and bowel control, as I told you, weakness of a leg or numbness, weight loss, high fever, or history of a cancer. Now, risk factors for back pain, as I discussed, and even Dr. Sachitra discussed, the main problem is a sedentary lifestyle with lack of physical exercise. I think we have, all over media, and we have all heard that how important physical exercise is and to reduce our weight. So if you are having a sedentary lifestyle, you must start exercising, and those little things like that will relieve you of these symptoms. And job related, seated for long hours, which I discussed, and lifting weights the wrong way, and sometimes long traveling for hours in a vehicle can lead to chronic back pain. And of course, smoking, excess body weight, bad posture, stress, and prolonged use of corticosteroids for certain diseases also can lead to those other risk factors for back pain. Of course, how would you diagnose a back pain? History is of paramount importance. So the medical practitioner or the physiotherapist or the general practitioner or the consultant should go through proper medical history of your back pain, the onset, how it occurred, the time period, any particular trigger factor, very important to know, and a family history of any conditions, chronic conditions like a rheumatoid condition, then the past medical history, like a cancer, whether you had, and the lifestyle assessment. And usually, I think with the history, 50% of the time, we can basically diagnose what the problem is for the back pain. And then it will be helped by the examination, and basically do a back examination to see how well you can move and any tender areas, any lumps, and a neurological assessment of your lower limb, doing a straight leg raise and to see whether your power and the sensation is okay. And sometimes you can do a little bit of thyroid nodule examination and ask for extra breast lumps, etc., to rule out any kind of malignant deposit. Then the investigations, usually these days, I think in my practice, by history and examination, most of the problems for the back pain is usually diagnosed. And maybe 60-70% of the time, it's diagnosed by history and examination. Of course, if you want to supplement your or support your diagnosis, you could go for blood test, maybe for certain conditions, the pooled blood count and ESR more than 100 for multiple myeloma and infective cause, CRP, then cubic antigen for a history of prostate problem patient. You don't need to really be paranoid about these tumor markers, but it can just suspect you can do. And of course, these days we do the vitamin D level, because lately I have found a lot of patients with the back pain and joint pains having low vitamin D level. Because then other thing is our sedentary lifestyle. Therefore, we have a kind of a generalized body ache, chronic back pain. It's good to do a vitamin D level and check your vitamin D level, and it's easily corrected with supplements, vitamin D3, and that's something that you can easily sort out. Then an X-ray of the spine, MRI scan, a CT scan, a bone scan if you suspect kind of a tumor, nerve conductional electromyogram if you suspect there is a nerve involvement for the back pain, and a DEXA scan, of course, to check for osteoporosis. Then how would we manage? I think Dr. Sachitra quite elaborated quite well on the management. It follows the same kind of line of like for neck pain. Basically, the primary therapy is related to the problem. As I told you, bad posture, then the posture has to be corrected. And if you have a coccyx, the tailbone pain, you can use a cushion which is called a coccyx cushion or a donut cushion, which is a rounded cushion, and that can relieve any pressure on your coccyx area. And sometimes if you sit forward rather than bending backwards and leaning back, the pressure on the coccyx is relieved, and that also helps to take the pressure out of the coccyx region. Then regular exercise with weight reduction, quit smoking. Well, I know it's difficult sometimes to get stopped, but a good idea if you're having chronic back pain. And avoid sitting for long hours, take a break every 40 minutes. Then a lumbosacral corset, like back support, which I have shown here, it's quite useful, especially if you are getting a recurrent chronic back pain when seated. You can wear one of these, and that will help you to maintain your posture and to reduce awkward posture and to control your back pain. Then, of course, the pharmacological treatment, we know simple things like paracetamol or Panadine, which is paracetamol with codeine. Then we all know about the NSAIDs, diclofenac sodium, ibuprofen, celecoxib, naproxen, mefenamic acid, Then if you have a neurological pain going along your leg like sciatica, we can use gabapentin, pregabalin, and amitriptyline. Then muscle relaxant like diazepam, alprazolam, tizanidine are useful. And of course, if it's osteoporosis, it involves a different treatment, a set of treatment with calcium, vitamin D, and bisphosphonate. That's a huge topic beyond our scope. And that is something that needs a little bit more special attention. Of course, surgical management, you don't require it most of the time. And with the proper history and examinations of industry, you can identify, and these are back pain usually is easily correctable. Therefore, you don't need to go for all these high-tech surgical procedures for most of the back pain. It usually involves, if you're doing a surgery, it's a discectomy, a spinal decompression, a spinal fusion with a fixation. And this kyphoplasty is, you can remember, I showed you a wedge fracture when you get osteoporosis, and this kyphoplasty is where we can put a cannula and inflate a balloon, and we can correct the height of the vertebra and fractures, osteoporotic. And you can see the spinal surgeries these days, it is done in this diagram, it's done with a very small incision using a microscope, and it's quite safe, but it's not commonly needed in most of the problems. And physiotherapy, as we said, is very important, and my physiotherapy colleagues will be going into detail with that. It's a very important part of managing back pain, so everybody needs to have a good listen to when they talk about it. And of course, these days, yoga is quite popular, and it should be done under supervision. It is done under supervision, the correct way, that also really help you to really most of these back pains, and that will help you to maintain your physical activity and strength as well. Right. Now, in summary, overall, 90% of back pain patients will settle within 2 months or so without the need for any surgical intervention. Back pain among children is very common, as we discussed due to the current online classes. They didn't have any physical interaction with friends. They're at home, seated most of the time. So it's very common. So it's good to get them to take breaks every 40-45 minutes, run around and then come back and sit. And I think the teachers also need to be educated on the importance of taking breaks between the classes. And regular breaks during online class, exercise, lifestyle management is of paramount importance to prevent and manage back pain. Thank you.
Thank you, sir, for the very informative presentation. We now invite you to watch patient testimonial video. Please stay with us.
And unfortunately, on the paralyzed both my hands and my right leg. I'm from the Netherlands, and I came to Sri Lanka for a three weeks motorcycle tour. And unfortunately, on the penultimate day of our return, I had an accident by driving in the back of a bus, which basically caused that I got a compression on one of my nerves, which basically paralyzed both my hands and my right leg. After being in hospital, in 2 public hospitals, which was not very pleasant, I was then transferred here to the private hospital Lanka, which had a much better impression in terms of things. And initially I wanted to go home to Holland, but you know, after I've seen here, and basically after that I picked up the because I was not able yet to use my mainly my right hand part of the body, which is my hand and my leg, so to walk and basically to use both hands. So I picked up quite a program here with physiotherapy to do 7 days a week, 3 times per day, pick up the thing. And I'm very pleased with the progress I made, thanks to the physiotherapy team, and especially to I expressed the thing to get regular physiotherapists. So there's always continuous type of treatment, which is Sharif, and he helped me really good to get the progress now, to go really to home. Now I will first go back to Holland, to the Netherlands, to have, let's say, the further treatment in Holland. But I already made a lot of progress, so hopefully in 3-4 weeks I will be able really to transfer from the rehabilitation clinic in Holland, in the Netherlands, back to my home in Ray, also in the Netherlands. So thank you for I really was pleased with the treatment here, both by with all the team here in the physiotherapy team, but also the rest of the hospital, as an international patient. I think more or less it's the same standard, same level of things as a hospital in Holland. But fortunately here you have more nurses than we have in Holland, so they can give you time to get the treatment.
Next panelist, Mr. Buddhika Rodrigo, Senior Executive Physiotherapist. Over to you, sir.
Good afternoon, everybody. I am going to explain about the back pain and neck pain. Let's see how a physiotherapist can help you. Let's see, talk about your spine. අපි බලමු මේ තුනට එකක්ම වෙල්ල එකක්ම භෞත චිකිත්සකවරයෙකු ෆිසියෝതെරපිස්ට් කෙනෙකුට කොහොමද අපි රෝගියෙකුට උදව් කරන්න කියලා. ඒක වළක්වා ගැනීම සහ සුව කර ගැනීම සඳහා. It's your neck. අපි ගත්තොත් ඔබේ neck ගල ප්‍රදේශය ගත්තොත් ඔයගොල්ලන්ට දක්න ලැබෙන මේ කශේරුක හත there are 7 cervical vertebrae. Out of 7 there are 2, first and second one somewhat specializedly work as a rotation of the neck. 180 degrees of rotation will provide by that 2 vertebrae. There are 8 nerves, and you can see somewhat intervertebral disc. This is working as a shock absorber of the vehicle to prevent normal pressure to the neck area and prevent to damage the neck area. Let's see about the vertebral column. There are 7 cervical vertebra, 12 thoracic vertebra, and 5 lumbar vertebra, fused 5 sacral vertebra take as 1 sacrum bone and coccyx. There are 31 pairs of peripheral nerves. Parenthesis now 31ක් මේක ගමන් කරනවා. අපි කතා කරමු පොඩ්ඩක්. Let's talk about the muscular system of the neck area. Here upper trapezius, deltoid muscle, sternocleidomastoid muscle, anterior muscles, suboccipital muscles, and skeletal muscles available. So when we compare the structure of that, so skeletal system, muscular system, soft tissue, බුදු පාටක, පේශිමය පාටක සහ අස්ථිමය පාටක දෙක 3-4 එකට එකතු වෙලා හොඳ දෘಢභාවයක් ලබා දෙනවා. දැන් අපි බලමු මේ රෝගීන් කොහොමද මේ how to complain of the neck pain. Some patients are complaining that when they are moving the neck, they are having somewhat pain. Some are complaining spasm, somewhat again, some are complaining numb or tingling sensation. Some are complaining some weakness of the hand. Some are complaining headache and radiating pains from backwards to forwards, tenderness of the neck area. Some are complaining shoulder pain and radiating pain throughout the upper arm. Then let's see, nerves are origin from the actually cervical area. And there is some compression from nerve root or nerve compression from the neck area. So our hand is saying mainly 3 nerves. Let's see about that: median, ulnar, and radius. Those nerves are innervated by brachial plexus, which is situated in the shoulder area and neck area. So now you can see the brachial plexus. This nerve passes from neck to fingers and get connected to the spinal cord via the brain. So when there's any compression from the neck area, so this will lead to distribution pains. So neck area to finger, if there's any compression, sometimes you can see somewhat pain. Then it's your back. When we compare about the back area, mainly we are having big muscle which is situated in back side of the neck, which is called erectospinae. This consists of 3 main muscles. In addition, so here skeletal system is here: vertebral column, scapula, humerus, pelvic bone, femur. Then those skeletal system get together with muscular system and soft tissues and giving some good rigidity to the back area. Then let's see about how to complain of the back pain of individuals. Sometimes they are complaining front side thigh pain, sometimes back side thigh pain, some are complaining knee joint pain, some are complaining lower back or lumbosacral area pain. Especially most of people, those who are having backaches, they used to complain on running pain, radiating pain. That is which is called sciatic pain. Let's see what is the reason for that. So these nerves are originating from lumbosacral area, lower back area. So there is some chance to compression of the nerves from lumbosacral area and distribution, somewhat pain occurs. Let's see about that. That when we consider the arrangement of the leg, there are 2 main nerves, femoral and sciatic nerve. You see that lumbar plexus. This is the nerve network which is situated in a lumbar area to innervate the femoral nerve mainly. Then you can see the sacral plexus, which is situated in the somewhat lower back area, sacral area, and innervate the sciatic nerve. These 2 nerves are working with our leg. So when we compare, so lower back and up to toes, if there's any compression, so patient will complain that he is in pain. So then when we compare the 100%, 90% due to day-to-day activity, when we are maintaining bad posture, this will lead to so many problems. So 90% due to mechanicals. As an example, day-to-day activities. When we are maintaining bad posture, this will lead to back and neck pain. So 10% due to non-mechanical or pathological. As an example, tumors, TB spine, other bone-related diseases, and muscle diseases. So latter must be reviewed especially by the consultant. So now I am going to explain how to grow up fetus to adult. When we compare the baby inside of the mother's abdomen, so there is a curve, only C curve we can see, vertebral column, spinal cord. When it goes up, it forms some 7 cervical vertebra, so 5 lumbar vertebra. So these 2 curves, primary curves and secondary curves, are maintaining balance of our body. Let's see about why human beings have it, neck and back pain. Let's talk about that. So evolution. According to the evolution, so reduce the area. Base of support is reducing. You can, if you go through this, you can see the reduction of area. So when reduce the area, reduce the stability. Because of that, human beings are trying to maintain the balance and form some pains. You go through this picture. This person is maintaining balance of the body. So central gravity is here, just nearby the second sacral vertebra. There is a center of gravity. You see somewhat base of support is here. So there is a line of gravity, imaginary line is there. If that line of gravity, center of gravity and base of support, if it is going in same line, so patient is having balance. So these anterior muscles are not working, not coming to the tension. Back muscles are okay. So likewise, he can maintain the balance of the body. When I explain about this picture, so a person is moving forward and backward, this will lead to center of gravity is shifting forward and reduce the balance and increase the back pain. Then how we balance ourselves. So as I explained, so skeletal system and muscular system and soft tissue. Asti paddhatiya, keshi paddhatiya, mudhu pataka get together to form some rigid body to the human. So when we compare these two pictures, first one, this person is maintaining center of gravity, line of gravity and base of support with weight. So when we compare this one, because of the big weight, so center of gravity is shifting forward and backward, and patient will feel pain due to overstretch of the anterior muscles, especially rectus abdominis muscle, back erectospinae muscles and other muscles, overwork of the muscles. Now I am going to explain about the flat shoes and high heels. Let's talk about that flat shoes. Normally this spine is fairly straight, so calf muscles are relaxed, no tension to the or weight to the knee joint, and evenly distributed the weight. When we compare the high heels, those who are wearing high heels, so chest is pushed forward, the lower back is pushed forward, and line of spine out of alignment, and excess of pressure placed on the knees. Because of that, the normal weight is not distributed evenly. So there's some chance to form some compression of the back, and patient will feel the pain. So now I am going to explain about some positions such as reading, writing and phone using. So now when we compare these three pictures, so this one is correct. He is maintaining back 90 degrees, not hunching. So 90 degrees of the legs, and is maintain his neck and back as much as possible, straighten and rest his hand on the chair. These two are the person is hunching. This person is also hunching. So because of that, anterior muscle, especially rectus abdominis muscle, back side, that erectospinae, both muscles are coming to the tension and feel the pain. Now I am going to explain about how to use phone. So this, when I explain this one, so this person is maintaining balance and using the phone. Here, take as a 5 kilogram is going through the body. You see that if he's bending forwards 30 degrees, so this weight goes up to 80 kilograms. If he is bending forwards 45 degrees, 24 kilograms are, and 70 if he is bending forwards, it will affect as a 28 kilograms. So when we compare these three, these anterior muscles, especially rectus abdominis muscle, back erectospinal muscles, and other suboccipital muscles of the neck, anterior muscles, anterior muscle of the neck, and not only that, so that weight will affect the vertebral column. So that is which is called degeneration. Wear and tear process is going on. So this will lead to form some cervical spondylosis and lumbar spondylosis. Main thing to overstretch and strain or muscle groups. So see the value of keeping your posture right as much as you can. If you know the balance, you can manage very well. So how to prevent it? Then now I am going to explain this one. This picture shows the correct position and he can prevent backache. You see this one is not maintaining a good posture, that is hunching. So get in it or take it. He will become a backache patient now. Sometimes he will undergo the surgery. So let's talk about the effective positions. What about sleep in position? So when we compare this, we used to advise to use hard bed, thin pillow with the touch of both shoulder. So we are advising to put the pillow under the knee joint and back will be straightened. And if you want, we can advise her to use another pillow also. So this is incorrect position and this is correct position when she is turning to one side. So we used to advise the patient to put the pillow in between two legs and there is a gap between the shoulder and head. So we used to advise the patient to put the thin pillow. When I explain about the sitting position, we are advising the patient to maintain the 90 degrees. So not hunching. In addition, so we advise to maintain 90 degrees here also. And neck and back should be straight. So now I am going to explain how to take the weight to maintain good posture. Here, this one is incorrect, taking the weight. So we are given knee joints by nature to take weight, not for back. So this is the correct way. So we are advising the patient to take the weight to the knee joint, not for back. So good posture at any age very much important. Good posture. Thank you very much.
Thank you, sir, for the very informative presentation. Let's move to our next panelist, physiotherapist, Mr. Mohammad Wesmi. Over to you, sir.
Thank you very much, Ms. Tirini. And good afternoon, everyone. And our consultants explained the pathology part and all the conditions almost regarding the neck and back. And I'm now going to go into the physiotherapy part and mostly the interaction between the patient and the physiotherapist. And we'll go into that, right? So when we think of the, back and neck conditions, this is like, at any age you can get by the reasons you have already know now, most of the reasons at any age. Mostly this is affecting the school children nowadays because as Dr. Ratnapala explained, now almost all the classes and schools, everything are online. And some other, when we are talking about the schooling, they are carrying very heavy bags. Not only that, office workers, mainly the IT, computer users, and not only the office workers also then, even when we talk about the housewives, right? And they are also doing a lot of works while standing and, then they don't know the ergonomical ways of sitting, standing, or even sleeping. So they get these of muscle or whatever the joint pains. And when we think about the reading, how to read properly and how to use the phone or the computer. And so it's those type of examples are there to, that are the reasons why you are getting this kind of muscle or the joint pain, right? Right. Now, I'm going to talk about the patient and the physiotherapist interaction. When you go to a physiotherapist, actually, we need a proper history from you. Actually, how you're getting, how did you get this back pain, and what were the reason, and so those type of things, right? And what are you having the problem? Actually, the current problem, what do you have? And any past medical histories or surgical histories related to your back or neck pain. I will talk about the past surgical history, because normally when you are getting the back pain, if you have a back pain, we normally ask whether you underwent any surgeries related to the back or the neck, because normally after the surgery also you may get the neck and back pain. That is because of your poor posture control. Okay. So that is very important. And the investigations we may need, because X-ray, MRI, because we have to see that to prescribe your exercise things, right? So these are very important, and we'll move on, right? And this is very, very important. And this is the scientific part of a physiotherapist, right? And to come to a conclusion, or to come to a diagnosis, we use the assessment, because then only we can prescribe the exercises properly. Then only you will overcome with the problem, and you will not recur the problem again. Right? Again, now when we think of this therapeutic approach to a patient, how we approach to a patient, right? We do that according to your complaints, or how the assessment, what are the assessment reveals, right? Whether we go to the acute side or the chronic side. If you get it's very recent, then we do the acute management, and it's a very longer one, then we go to the chronic management. Right? In the acute side, what are the what you mostly feel, right? When you get a pain acutely, right? What you mostly feel? You may feel kind of swelling, right? Or pain. With that pain, you may feel loss of function, right? Right. So how we manage this acute state? Mainly we use the ice pack, right? So we don't know. Most of the people don't know about the ice pack. They use the hot pack first, but in the acute stage, we have to use the ice pack to reduce the inflammation and to stop this pain thing, right? When you in a need of electrotherapeutic treatment, right? Electrotherapeutic treatment in the sense, right? In this first picture, it is shown the TENS, or the interferential therapy, right? That is to control your pain by blocking the pain gate. And this is shown heat treatment. It is a deep heat, shortwave diathermy. And this is shown a traction, neck traction. This is shown, and we are using this for the back also. And this is the ultrasound therapy, right? And we use this for kind of muscle spasm or any kind of injuries, right? So when you in the need of electrotherapeutic treatment, yes, we do, right? But of course, very importantly, you have to keep this in your mind. No, any electrotherapeutic treatment will cause a permanent, stopping of your problem. Or then, if I say like this, the electrotherapeutic treatment is going to stop pain. Do a pain management only, right? An acute stage management it will do. But if you want to stop it, if you don't want to recur it, then you have to go to the therapeutic exercise part. Exercise part is the very, very important part. As a physiotherapist, I want to say this because therapeutic exercises are they are to help you from recur, right? So these are some, very few exercises. This has been shown, right? For the back, again, to the neck, right? And the posture care is to care of, to avoid recurring, right? Avoid recurring. The posture care is very important. Postural things, it was explained very well by our consultants and my colleague as well, right? And I'm going to move on. And this slide is saying a very precious treatment and that physiotherapists hold. Actually, manual therapy or manipulation, right? We do this for peripheral joints in the sense elbow, wrist, shoulder, hip, knee, whatever, right? And for the vertebral as well. Vertebral column, when we talk about the vertebral column, neck, thoracic or the chest part, the back, lumbar area, right? The manual manipulation is very, very important because when actually to apply the manipulation, we have to assess whether you are eligible to do this, because in some cases we can't apply the manipulation because, for example, osteoporosis, right? Severe osteoarthritis with the external, extra calcium formation, like, right? So when we, but if I explain the manipulation a few, right, a little, right, what we do is we are moving or mobilizing the small joints internally, right, to reduce your pain and to get the range of motion more, right? And the kinesiology taping is the other option. It is also very, very important. And these are actually, this may give far better results when it is done accurately, right? At once you will feel, at that one session, you will feel much better, right? Okay. Right, and this is again a special area we had to concern. Make a Samaharaya Karlakkati, the aquatic physiotherapy, and we use this. We use the water to do the exercises. When we talk about this aquatherapy, we have a lot of equipments to get a lot of to get a lot of outcomes. Like, for example, we can do the strengthening exercises, right? And we can increase your range of motion. If it is less, we can relax your muscles, right? And a lot more things, right? Okay, right. So what is the main thing is you have a upthrust in the water, inside the water. So if, for example, if you have a problem with your when you walk on the land, if you have a problem with the pain when you are giving the weight to the joints, if you walk under the water, right, you won't feel that pain. Almost around 90% it will relieve because you have an upthrust in the water, so it will give you a very good effect. So that is the specialty in the aquatic physiotherapy, right? When we talk about the chronic stage treatment, you may sometimes be given the electrotherapeutic treatments, right? That is, of course, according to the assessment part. But here again, I want to remind you, electrotherapeutic treatment won't give you prolonged effect. It is going to give you an acute effect. But the therapeutic exercises under a qualified physiotherapist is going to give you, very good effect, and it will give you a prolonged effect, and it won't recur. It won't recur, right? The problem won't recur, right? So therapeutic exercises are to play a vital role in the chronic stage, and active lifestyle. After that, the active lifestyle to promote your health condition, and postural care is to prevent the recurrence, right? So the other aspect is the back and neck pain can be caused by the psychological factors as well, right? This is also explained by our consultants. For example, stress and anxiety, depression, right? Those kind of things. These kind of things actually make your muscles spasm, right? So how this can be avoided, or how this can be relieved a little? Maybe breathing exercise along with your medication, the breathing exercises, right? Focused exercises towards that joint or the muscles or the soft tissue, whatever, and soft tissue release techniques, right? Like massaging, right? Likewise, and some general routine exercises may help you. What are the general routine exercises? Maybe swimming, walking, running, jogging, likewise, right? So those can help you to relieve from this kind of problems, right? This is very important. I want to tell you, most of the patients are coming to us and asking whether we can wear a collar. right? And they, I mean, without any prescription, without prescription from a consultant or any physical therapist, they are just wearing the neck collar or the lumbar corset, because these are not advisable to wear in every case, right? When you wear the collar, you must know your muscles can, can be wasted. So from there onwards, you may get problem by the muscle wasting, right? So of course, this must be worn under prescription or under the recommendation of the consultant, or a physiotherapist also can tell you, right? Anyhow, right? Please, when you want to, go with this collar or the lumbar corset, you must be aware of these things, right? Okay, so do your exercises under proper guidance of a qualified physiotherapist and take care of your posture, follow the correct neck and back discipline, avoid recurring, right? This is the way to avoid this problem, right? So we are there with the professional physiotherapy team at Lanka hospitals, and our consultants are also there, right? When you go to the consultants, they will refer to us, and if you come to us, we will refer to the proper consultant. The consultants they are here, right? So you can meet us at the Department of Physiotherapy. Thank you very much.
Thank you, sir. And now, if you have any questions, please let us know.
So there are several questions. I will, yes, sir. So what we can say is, like, Corona itself has so many, there is something called post-COVID syndrome. It can have so many other associated residual symptoms, and you may have muscle aches. So this can well be part of the post-COVID syndrome. Other thing is, we discussed that emotional stress can also reduce neck pains. So it could be either of them, not just the COVID. Right? Other thing is, like, our posture during this lockdown period. So that could well have contributed to this as well. So I hope that answer is adequate. And the second question is, can a numbness in the right hand thumb pad be due to a problem in the neck? It could well be due to that, but it could also be due to, like, a nerve getting trapped in your wrist. To, like, take the history and examine you to come to a proper diagnosis to see whether this is a nerve which has got trapped in the neck or a nerve which has got trapped in your wrist. So I think Dr. Devaka will take the rest of the questions.
Yeah, thank you, Sajitra. The next question is how to manage neurogenic claudication medically. How long to give medicines for? Actually, there are two types of claudication. It's a vascular or a neurogenic. So the first thing is you need to diagnose which type of claudication it is. Usually a vascular claudication starts from your feet, legs, thighs, comes up, but a neurogenic claudication goes from the back, thighs, leg, that way. And now when it comes to neurogenic claudication, it's usually due to the narrowing of the spinal canal, where the spinal cord or the chorda equina, which is the last part of the spine, gives out the nerves, the nerves to the lower limbs, and those get compressed due to narrowing of the canal. Now, of course, temporary, we can give symptomatic relief medically with the gabapentins and the anti-epileptic drugs, and the SSRIs and amitriptyline drugs, drugs like that, to reduce the pain. And of course, you can give analgesics as well. But when it comes to the proper definitive management, since it is a narrowing, a physical blockage in the canal which is causing the problem, it usually needs surgical intervention. And this physical blockage could be due to ligamental disc complexes or as I mentioned in my presentation, condition called spondylolisthesis, where a vertebra moves forward over the other. That also can lead to narrowing of the canal. Since it's a physical blockage, usually medical management is symptomatic, but definitive treatment will involve canal decompression and sometimes some kind of fixation to stabilize the vertebra, adjacent vertebra.
So the next question is how to overcome leg cramps. There can be many causes for leg cramps. So the management will depend on the cause. So sometimes when if there are electrolyte abnormalities, so that can cause, if you are sometimes certain medication that you take to reduce your cholesterol, all these things can cause, but then it's very difficult to give a broad answer for this without knowing the cause. Sometimes correcting the cause itself will resolve the leg cramps. Use for sitting posture or any chair works. Well, it's difficult to say because I don't think all these chair manufacturers think about the ergonomics. Now that we have explained to you, if you are going to purchase a chair, I think you have to you have to keep your ear, shoulder, and hip at one line, and then 90 degrees from the hip joint and 90 degrees from the knee joint. So whatever chair that serves that purpose, you will have to decide, because otherwise we cannot recommend that this chair is like suitable. So you will have to keep these things in mind when you go to purchase a chair.
And with that, we shall conclude the webinar now. I would like to thank our distinguished panel speakers for taking their time today to take part in this session. And on behalf of Lanka Hospitals, I would like to thank all of you who participated in today's webinar. I would like to add that we have a 15% discount e-voucher for physiotherapy treatment, which we will be emailing across to you all those who participated today. If there is anyone else interested in receiving the 15% discount e-voucher, please kindly call or WhatsApp our physiotherapy hotline, 070 353 1117, and we will send it across to you. You may also contact us on our orthopedic hotline for any inquiries, or email us at info@lankahospitals.com. Thank you again for joining us today. Thank you so much and take care.